We're going to officially start our agenda, and I am absolutely enchanted and delighted that Dr. Norma Talbo can join us today. And Dr. Talbo actually started her medical career and graduated at the University of Santo Tomas in Manila, Philippines. And then she came to the United States, migrated in 1972, and started her residency in psychiatry at the Essex County Hospital in the New York Hospital. She worked in psychiatry and neurology, and she's a consultant for inpatient and outpatient psychiatric services. One of the things that I hear time and time again, either from your children or from you yourselves or your spouses, is that loneliness, depression, the weekends are tough, the evenings are tough, during the day it's okay, but I really have a hard time on Sunday, I have a hard time on Saturday. And so Dr. Talbo works in psychiatry and neurology, and it's very important because we have a friend at Newbridge Services now. Dr. Talbo is a medical director of Newbridge Services. She's been there from 1993 till present, but many of the people that I suggest say, oh, I haven't heard of that or whatever. So when Dr. Talbo agreed to be here and to speak, I was just elated, and so was the committee. And Dr. Talbo said, would you mind if I brought Paula Tedesco, my nurse practitioner, who has worked for 5 years with Newbridge and has worked in the seniors program, the Operation SAIL, Senior Assisted Independent Living. And what Paula does, she wants people to remain in their homes, and she comes and she does some assessments so that you can retain and live in your home and get some support services. They're going to tell you a little bit about what they do, and I am absolutely elated. So give them your undivided attention, and Dr. Talbo will answer questions. Thank you, Doctor.
Thank you, Deborah. Good morning, everybody. It is a pleasure for me to be here with you all, and I see the ladies are so pretty and beautiful, and the gentlemen are so dashing and handsome. I just spent the weekend in Georgia to visit my 90-year-old mother, spending Mother's Day with her. So I love being here with you. I'd like to thank also Deborah and Larry for inviting us here to speak to you about Germinating Happiness. They are also great support for Newbridge. I thank you both. So what is Newbridge Services Incorporated? Newbridge is a community mental health center that was originally started in 1962 by local ministers under the leadership of Reverend Donner Atwood of Compton Plains. It was then named Pequannock Valley Mental Health Center. Since then, it has expanded in services. In 1998, the name was changed to Newbridge Services Incorporated. We now serve part of Morris County and Upper Passaic County. We have 5 core areas. They're counseling, addiction services, SAIL, which is Senior Assistance for Independent Living, youth and housing services. Nearly 10,000 individuals are assisted annually. Newbridge continues to expand and develop programs to improve the quality of life of those we serve. There are approximately 200 trained professionals, including child and adult psychiatrists, psychologists, nurse practitioners, nurses, social workers, drug and alcohol counselors, as well as other allied professionals. One of our offices is just located around the corner. We are at 390 Main Road here in Montville. Today, we are going to talk about Germinating Happiness and the tools to combat loneliness and depression. First, I'd like to differentiate what is loneliness and depression. Loneliness is not a clinical entity or a clinical diagnosis. Depression is a clinical diagnosis. So what is loneliness? Loneliness is a condition or emotional state brought about by being alone. Has anyone experienced loneliness? We all do from time to time. As Deborah said, I came from the Philippines, and when I came to the United States, I was alone. I left my mother, my father, brothers and sisters, friends and boyfriend. So being alone in the United States was a challenge. I contacted my cousin who was a doctor, and with her help, she was able to help me settle in New Jersey and get a job, expand my friends and support system. So how can you prevent loneliness and germinate happiness? As John said, quote, "No man is an island," unquote. So one should develop and maintain relationships. Family is very important. Friends are very important. Even having a pet, a dog or a cat, is something that helps you alleviate your loneliness. Stay active, get involved, come to the senior house. Stay connected with people through the telephone, social media, such as Facebook, email, and Twitter. Develop a hobby or activity that will spark your interest and keep your mind and body active. You can join a club, play a sport, or even sign up to be a volunteer. So the key tool to avoiding loneliness or combating loneliness is avoid being alone. Now, what is depression? Depression is one of the common psychiatric disorders. It's like the common cold of psychiatry. 15 to 20 out of every 100 people have experienced a period of serious depression at some time in their life. But it is important to know that there are many reasons to be optimistic about depression. First, it is certainly a treatable condition. There is treatment available, people can manage their illness, and people with depression can lead productive lives. There are famous people who have experienced depression. For example, Churchill, Albert Einstein, Abraham Lincoln, Princess Diana, and many other people. So how do you know whether you have depression? The major symptoms of depression are, you can feel sad, of course, you have crying spells, you have a loss of pleasure of your daily activities, you can get anxious, you can eat too much or too little, so you can either lose weight or gain weight. You have a sleep disturbance, you have difficulty falling asleep, or you may have early morning awakening. You may have low energy or feeling tired all the time. You have difficulty concentrating and making decisions. When the depression gets worse, you can have guilty feelings, you can have suicidal thoughts, or you can have also psychotic symptoms. What I mean by psychotic symptoms is you can hear voices or you can feel paranoid that other people are talking about you, which is not real. So what is the cause of depression? The symptoms of depression are caused by a chemical imbalance. These chemicals are called neurotransmitters, and they are dopamine, norepinephrine, and serotonin. What triggers this imbalance? There are many factors. First of all, you can have genetic vulnerability. For example, if you have a family member, aunts, uncles, parents, brothers, sisters, cousins who have experienced depression in the past, you can be vulnerable and you have a higher risk of developing depression. Loss of a loved one, financial loss, loss of a job, retirement, loss of independence due to the aging process, medical problems, people who have suffered a heart attack or a stroke usually develops depression. And any stressors or any traumatic events, for example, the 9/11 event, can also trigger depression. Alcohol or any kind of addiction, alcohol, drug, prescription drugs, can also trigger depression and a chemical imbalance. In women, it can occur after delivery, and we call that postpartum depression. In children, it can also happen in children because when they lose a parent through divorce or whatever, they can suffer from a depression. Let me give you a little vignette about somebody that I saw many years ago. I'll call him John. He was 64 years old and he was recently divorced. He was referred by his family physician. He complained to his family physician that since his divorce, he could not concentrate, he could not function at his job as an accountant. He had lost interest in all his daily living activities. He could not sleep. He had no energy to do anything. He lost his appetite and he had lost weight. Eventually, he lost his job, so he lost his income. He stopped going out with his friends. He stopped seeing his children. He became hopeless and helpless and had some suicidal ideations. What is life for? He said. So the doctor, his family physician, recognized that he had depression. So he was referred to Newbridge, and our sales staff went out to assess him, and he was referred to our outpatient department. I recommended individual therapy weekly as well as medication, antidepressants. He was given Zoloft, 50 milligrams once a day, and after a month or so, he started to perk up, he started to gain weight, he started to sleep better, and by the second month, he was no longer hopeless or helpless. Then he was able to re-establish his relationship with his family and friends and started to look for another job. Soon after, he was back to his old self. He became productive again, and he met a nice woman, and they lived happily ever after. So that's how you terminate happiness. Okay. What is the treatment for depression? You can manage your illness, you can manage depression by building your social support. It is very, very important to have a social support system around you, whether it's family, friends, or even the community. Come to the senior house. Be active in the community. Learn how to cope with stress. Learn how to cope with symptoms. Get help for your medical problems. Having a healthy body gives you also a healthy mind. Get help from Newbridge or other professionals, because there is certainly help for depression. Other treatment for depression that we use, of course, are antidepressants. These are medications that help to lift your spirits. It does it by reverting the chemical imbalance in your brain, but you do have to take your medications every day. Some antidepressants that I have listed in your brochure, we have Elavil, Pamelor, Imipramine, Zoloft, Celexa, Cymbalta, Wellbutrin, Vibrid, Sinequan, Nortriptyline, Prozac, Paxil, Lexapro, Effexor, and Prestige. There are many medications now that are available for depression, and you may have seen those ads on television. Other medications used for depression too are Seroquel, Abilify, Lamictal, MAO inhibitors or monoamine inhibitors. And we also use lithium and Depakote, which are mood stabilizers. Medications will revert the chemical imbalance in your brain slowly. It may take 6 months to a year to completely revert the chemical imbalance in your system. But it does not mean to say that it will take 6 months to a year for you to get better. Usually in a month or so, you start to feel the difference. And people around you, your family, will begin to notice you're starting to smile, you're starting to do some cooking, you're starting to do your gardening or your hobby. Other forms of treatment for severe depression is electroshock treatment, transmagnetic stimulation, and of course, hospitalization. How can you germinate happiness? First of all, have a support system, stay active, manage your illness, be proactive, and of course, don't be afraid to get help. While loneliness and depression may seem extremely daunting, there are many methods to alleviate the symptoms that come with these conditions. There are many mental health professionals, including social workers, nurse practitioners, nurses, psychiatrists, who can aid you in managing depression. With proper management, you can live a normal, productive life. So don't forget, if you need help, call Newbridge Sales Services. And with this, I'd like to turn this over to Paula Tedesco, our advanced nurse practitioner. Thank you.